Picture this. The world as you know it has crumbled. No emergency services, no hospitals, no pharmacies on every corner. Just you and whatever supplies you can scavenge from a civilization that's now nothing more than a memory. And then it happens. The sharp crack of gunfire echoes through the silence, followed by that burning sensation you never wanted to feel. You look down and see crimson spreading across your shirt like spilled paint on canvas. What happens next determines whether you become another casualty or whether you live to see another sunrise. Most people think they understand trauma care because they've watched medical dramas or taken a basic first aid course. But when society collapses and you're bleeding out in an abandoned building with nothing but whatever you can find in a bathroom cabinet, those television fantasies become brutally irrelevant. The human body is remarkably resilient, yet terrifyingly fragile. A single projectile can create devastating damage in milliseconds, but understanding the mechanics of survival can mean the difference between becoming fertilizer and walking away from what should have been your final moments. Today, we're diving deep into the brutal reality of battlefield medicine when the battlefield is everywhere, and the medics are nowhere to be found. Here's what nobody tells you about gunshot wounds. They're not just holes that need patching up like a tire puncture. They're complex trauma events that trigger cascading physiological responses throughout your entire system. Your body immediately begins a desperate fight to keep you alive, but it needs your conscious mind to make the right decisions in those critical first minutes. The clock starts ticking the moment metal meets flesh. Every second that passes without proper intervention reduces your chances of survival exponentially. But here's the encouraging part. If you understand the fundamental principles of trauma management, you can work with your body's natural healing mechanisms instead of against them. Let's start with the most immediate threat: blood loss. Your circulatory system operates under pressure, and when that system gets compromised, you have minutes before unconsciousness and potentially death. The average adult body contains roughly 5 liters of blood. Lose 1 liter and you'll feel weak. Lose 2 liters and you'll go into shock. Lose 3 liters and you're looking at a very short future. The first rule of hemorrhage control is simple but absolutely critical. Direct pressure saves lives. Find the cleanest material within arm's reach. This could be a shirt, towel, pillowcase, or even a sock if that's all available. Fold this material into a thick pad and apply it directly to the wound with firm, steady pressure. Think of yourself as creating a dam to stop a flood. Your instinct will be to lift the material and check if the bleeding has stopped. Resist this urge completely. Every time you lift that makeshift bandage, you're disrupting the clot formation process that's desperately trying to seal the breach. Instead, if blood soaks through your first layer, simply add another layer on top. Keep adding layers until the bleeding stops or slows significantly. For injuries to arms or legs, elevation becomes your ally. Gravity is free and surprisingly effective at reducing blood flow to areas above heart level. Position the injured limb higher than the heart whenever possible, while maintaining that crucial direct pressure. But what happens when direct pressure isn't enough? When you're dealing with arterial bleeding that pulses bright red with each heartbeat, you need to escalate to more aggressive measures. This is where improvised tourniquets become lifesavers. Creating an effective tourniquet requires materials at least 2 inches wide. Narrow items like shoelaces or wire will cut through tissue rather than compress blood vessels. Look for belts, torn strips of sturdy fabric, or even a dog leash. Position this material several inches above the wound, between the injury and the heart. Tie the tourniquet snugly. Then find something rigid to use as a windlass. A stick, pen, screwdriver, or similar object will work. Insert this through your knot and begin twisting to tighten the tourniquet progressively. Continue tightening until the bleeding stops completely. The pain will be intense. This is normal and actually indicates the tourniquet is working properly. Mark the time you applied the tourniquet somewhere visible. Write it on the skin with a marker, carve it into a nearby surface, or use blood to mark a wall. This timing is crucial because tourniquets can only remain in place for approximately 2 hours before tissue damage becomes irreversible. Once you've controlled the immediate bleeding, the next challenge becomes infection prevention. In a post-apocalyptic scenario, antibiotics may be scarce or non-existent, making infection control even more critical than in normal medical situations. Wound irrigation is your first line of defense against bacterial invasion. You need to flush out debris, fabric fragments, and contaminants that entered the wound channel. Ideally, use boiled water that has been allowed to cool to room temperature. If boiling isn't possible, bottled water works. In desperate situations, even tap water is better than leaving debris in the wound. Pour the water directly into the wound in a steady stream, not a gentle trickle. You're attempting to physically wash out contamination, which requires sufficient flow pressure. If you have access to saline solution, this is preferable to plain water. After irrigation, you need to pack the wound properly. This step is often misunderstood, but absolutely essential for internal bleeding control. Using sterile gauze when available, or the cleanest fabric strips when it's not, you'll systematically fill the wound cavity from deepest to shallowest areas. The packing process requires patience and precision. Layer the material methodically, applying firm but not excessive pressure. You're creating internal compression to stop bleeding you cannot see while providing a framework for tissue healing. The packing technique isn't about stuffing material carelessly into the wound like you're filling a pillow. Think of it as architectural engineering. Each layer of gauze or cloth needs to support the next, creating a structured foundation that your body can build upon. Start at the deepest accessible point and work your way outward, ensuring no air pockets remain that could harbor bacteria or allow continued bleeding. For through-and-through wounds where the projectile created both entry and exit points, you'll need to address both openings with equal attention. The exit wound is often larger and more irregular than the entry point, requiring additional material and care. Pack both wounds following the same methodical approach, then secure everything with the largest clean dressing you can find. Medical tape is ideal for securing dressings, but in a collapsed world, improvisation becomes necessity. Duct tape works remarkably well, though it's painful to remove later. Even electrical tape or strips of cloth can hold dressings in place when nothing else is available. The key is creating a seal that won't shift or loosen as you move. Now comes the part most people don't consider until it's too late. Infection prevention when pharmaceutical antibiotics aren't an option. Bacteria don't care about your survival plans, and they'll colonize any warm, moist environment you provide them. Without proper intervention, even a survivable gunshot wound can become a death sentence through sepsis. Natural antimicrobials become your pharmaceutical substitutes. Raw honey, not the processed variety, contains powerful antibacterial properties that have been documented for centuries. Apply a thin layer directly to the wound before placing your final dressing. The honey creates an environment hostile to bacterial growth while providing moisture for tissue healing. Crushed garlic mixed with a small amount of oil creates another potent antimicrobial paste. The allicin compounds in fresh garlic demonstrate significant antibacterial activity. Yes, you'll smell like a kitchen, but that's preferable to smelling like decomposition. Tea tree oil, if available, can be diluted and applied to wound edges. Even salt, dissolved in clean water to create a concentrated brine solution, can help cleanse wounds and create an environment less favorable to bacterial growth. Your body's response to trauma extends far beyond the immediate injury site. Shock represents your cardiovascular system's inability to maintain adequate circulation throughout your body. It's a cascade failure that kills more gunshot victims than the actual bullets. Recognition becomes critical because shock symptoms often appear gradually. Your skin turns pale and feels cold to the touch. Your pulse races as your heart desperately attempts to circulate whatever blood remains. Breathing becomes shallow and rapid. Mental confusion sets in, and you might not even realize you're experiencing these symptoms. Treatment for shock requires immediate positioning changes. Lie down flat and elevate your legs above heart level using whatever materials are available. Backpacks, boxes, or even folded clothing can prop up your lower extremities. This position helps return blood to your vital organs. Temperature regulation becomes crucial. Your body loses the ability to maintain normal temperature during shock, so external warming becomes necessary. Use blankets, jackets, or any available insulation to prevent heat loss. Even newspapers or cardboard can provide insulation layers. Fluid intake needs careful management during shock. Small sips of clean water help maintain blood volume without overwhelming your compromised circulatory system. Avoid large quantities that your stomach can't process effectively. Pain management in a post-collapse scenario requires creativity and resourcefulness. Willow bark contains salicin, a natural precursor to aspirin. Chew the inner bark or brew it into tea for mild pain relief. Clove oil numbs localized pain when applied topically. Even controlled breathing techniques can help manage pain levels through natural endorphin release. The psychological component of trauma treatment often gets overlooked but remains equally important. Your mental state directly affects your body's healing response. Panic increases heart rate and blood pressure, worsening bleeding and shock. Maintaining calm focus, even in desperate circumstances, improves your survival odds significantly. Create mental checklists to maintain focus. Bleeding controlled, wound cleaned, dressing secured, shock prevented. This systematic approach prevents oversight of critical steps while giving your mind concrete tasks to focus on, instead of spiraling into panic. Understanding wound healing phases helps you monitor progress and identify complications. The inflammatory phase begins immediately and lasts several days. Expect redness, swelling, and warmth around the wound site. This represents your immune system mobilizing to fight infection and begin repair processes. The proliferative phase follows, lasting weeks, where new tissue begins forming. Finally, the remodeling phase can continue for months as your body strengthens and reorganizes the repair tissue. Complications signal the need for immediate intervention changes. Increasing pain rather than gradual improvement, foul-smelling discharge, red streaking extending from the wound site, or fever all indicate serious infection requiring aggressive treatment. Your survival depends on making correct decisions during those first critical hours when shock, blood loss, and infection risk are highest. Every choice either moves you toward recovery or closer to becoming another casualty of a world that no longer offers safety nets. There you have it. The brutal mathematics of staying alive when civilization has packed up and left you behind. Direct pressure stops bleeding. Tourniquets buy you time when pressure isn't enough. Clean water flushes out contamination. Proper packing controls internal bleeding. Natural antimicrobials fight infection when pharmaceuticals are just memories. Shock positioning and temperature control keep your cardiovascular system from surrendering completely. These aren't pleasant skills to possess, but they're the difference between bleeding out in silence and walking away from what should have been your final moment. Your body wants to survive. It's already fighting for you from the cellular level up. But it needs your conscious mind to make the right choices in those first critical minutes. Practice these techniques now, while the world still has hospitals and the luxury of second chances. Because when that luxury disappears, when you're alone with a hole in your body and nothing but improvised supplies, muscle memory and knowledge become your only allies. The clock is always ticking, but now you know how to buy yourself more time on it. Stay sharp, stay prepared, and remember that survival isn't about being invincible. It's about being too stubborn to quit when everything goes wrong.